As thiopental starts to act, it affects your brain bit by bit. And this is the key to one of its more controversial uses. The Americans noticed that when patients were in that twilight zone halfway between consciousness and unconsciousness, they became more chatty, disinhibited, and also forgot what they'd been talking about afterwards. They decided this might form the basis for a truth drug, an interrogation drug. Now, I'm going to have a go at trying to maintain the fiction that I am Dr. Michael Mosley, the famous heart surgeon. Okay, so I'm actually feeling quite anxious at the moment. Sodium thiopental has a reputation, not just as a truth drug, but also because it's used in lethal injections. Anaesthetist Austin Leach will be monitoring my vital signs throughout. These will indicate if my body is feeling pain. Before I take the drug, he wants to see how my heart rate responds when he crunches his knuckles against my chest.
That's quite uncomfortable, yeah. Ooh.
My heart rate jumps from 54 to 64 in response to pain. Now it's time to experience the effects of a light dose of sodium thiopental.
I'll just give a small dose, but quite rapidly. It's in now.
Yeah. Doesn't feel like anything.
Oh, it hasn't got there yet.
That's probably why I'm not feeling anything. Am I feeling distributed? Oh, yes, there it goes. Yep, there it is. Blimey, wow. Oh, geez, yeah. No. That is like, oh, that's like drinking a bottle of champagne.
So, under the influence of thiopental, can I still lie about my job?
I am a cardiac... I'm a cardiac surgeon.
And would you like to
I'm a
tell
world-famous cardiac surgeon.
Would you like to tell me what the last operation you carried out was?
It was a bypass. They survived. But, yeah, I was awesome.
And now I'm just going to repeat the pain test.
Yeah, OK.
In your sternum, and tell me how uncomfortable this is.
Oh, that hurts, but it doesn't really hurt. I'm kind of aware of it, but I don't care. It's actually quite painful.
My heart rate jumps right up. My body is still responding to pain, but bizarrely my brain isn't. It's all very odd.
That is so strange.
I had just about managed to lie about my job, however unconvincingly. But what would happen if he upped the dose?
Oh, yes.
The drug's effects aren't predictable, so I don't know what will happen.
Yeah. Ask me any questions.
So, what is your name?
My name is Michael Mosley.
And what is your profession?
I'm a television producer. Well, executive producer. Well, presenter. Some mix of the three of them.
So, you don't have any history of performing cardiac surgery?
None whatsoever. None whatsoever. I am, without doubt, a good television presenter and a lousy cardiac surgeon.
Part of the reason I caved in so quickly is I had this overwhelming urge to tell the truth. It's an odd feeling, quite cathartic.
The weird thing is I don't want to lie. You know, I'm feeling so... It's not just that I can't. It's just I feel so benign towards the world that I don't want to do it. I don't want to say I'm Michael Mosley, a cardiac surgeon, because I'm not. So,
What else I admitted to under the drug's influence must remain forever secret. From me as well. Afterwards, I realised I had forgotten everything that had happened.
Did I confess to the fact that I'm not a cardiac surgeon?
So you can't remember? You can't remember what it was you said about your professional status?
No. I mean, I don't know what I was talking about. Yeah. I feel quite snoozy. I feel like I could probably go to sleep now.
And that's the reason thiopental became such a popular anaesthetic drug. It puts you to sleep quickly and with just a simple injection.